The primary endpoint was progression-free survival, which showed an absolute improvement of 5% by independent review panel. By investigator, that was 6.6%, which could seem small or modest, and if we translated that to a number needed to treat, that would be a number needed to treat of 20 with the new therapy to prevent one modified progression-free survival. But it's important to put that in context of standard ABVD is associated with a very high progression-free survival rate. And so when you're adding 5% on top of that, another way to look at that are the relative risk reduction, which was approximately 23% risk reduction of modified progression-free survival. Importantly, when looking at typical progression-free survival, at least by investigator, that also showed a 6% improvement for the standard arm. And that was all patients in all countries. There were some important subset analyses. One was patients with different high-risk factors, whether a high Ossenclever prognostic score, number one. Number two, also individual factors, such as male gender, stage 4 disease, multiple extranodal sites, etc. Those patients seemingly garnered additional benefit, more than the 5%. And then one other important finding, and we don't really understand why, were patients treated in North America had a even more significant benefit. That benefit was an approximate 12% absolute improvement in terms of progression-free survival with the Adcetris AVD therapy. And if you calculate that number needed to treat, that would be 8 patients to be treated with the new therapy to prevent one modified progression-free survival.